Hi, my name's Callie Gallion. Today in my video, I'm going to be doing a IV push as well as a piggyback. So first thing I'm going to do, go back to my patient that I had earlier that I administered the IV to and the fluids. I'm going to look in their MAR. I'm going to see what orders has now been placed, which is a medication push and a piggyback, another medication, which is through the IV. So, looked at my name and date of birth and any allergies as well. So I'm gonna gather all my supplies up. Of course, while I'm doing that, I'm gonna be doing my GPSP skills as well as my 3 med check off and my 11 rights administration. So, of course, while I'm getting all this stuff, I'm going to be making sure that there's any contradictions between the meds and the fluids. That's all going to be going into my patient. The appropriateness of them, the purpose of them. I'm also going to be looking at my bag, color, leakage, any expiration date. If my med also needed to be diluted, and I'm going to draw it up from an ampoule or tubing that it's coming from. So I've got everything now. I'm going to bring it into my room, knock on the door. I'm going to introduce myself. I'm going to check the patient's wristband for, ask them their name, date of birth. Everything checks out. And now I'm going to ask them if they have any known allergies as well again. Okay. Now, once I do that, I am going to go ahead and prime my tubing before I start anything else. Okay. My primary bag has to hang lower. And I'm going to go ahead and clamp it off. Okay. Now I'm going to take my medication. Of course, I'm going to check this again for my 3rd check. No, I'm not going to open that up just yet. Open the end of this, making sure I don't touch anything. That way it stays clean. I'm going to insert it. Turning, pushing method. Fill my chamber up halfway. Alright, and I'm going to go ahead and prime my tubing. Of course, I want to make sure that it's closed. Open the cap. Making sure I don't touch that. I'll let some of the fluids run through. Close it back on. Making sure there's no air bubbles. Put my cap back on. I'm just going to touch it up here to get it out of my way. Okay, so now, of course, I'm going to be letting my patient know what's going to be going on while we're giving them these meds. Give any type of teaching about it and let them ask any type of questions as well. So before I start my actual med push, I'm going to check my IV, make sure everything looks good, there's no infiltrates, perform some hand hygiene again. So the IV site looks really good. Now we're gonna put our gloves on. Now I checked it earlier, all of my stuff hanging and my med push is all compatible. Of course, I'm going to take precautions as well. Okay, I'm going to take my flush. Scrub my hub real good. Let that dry. Or I'll just scrub it again since I dropped it. Okay. All right, now that it's good and scrubbed, it's dried, I'm going to apply my flush. Okay. Now I'm going to flush my IV, make sure thing goes through. Okay, it's flushing, good. Take this back off. Now let's go ahead and take a new alcohol wipe. Scrub the hub again. We're going to be doing that quite often during this. Okay, I have my medication ready. Now, as I'm pushing this, I want to make sure that I have a watch on that has the second hand, the smaller one. And I'm going to make sure to enter this at the correct rate that was asked for. Earlier, I went ahead and clamped off my large bag, no primary. So this medication asks to be given within a 1 minute time frame. So we're going to push that in slowly for 1 minute. Okay. All right, now we're going to scrub our hub one more time. We're going to do another flush. Flush it through at the same rate that I did the medication, because there could still be medication within the tubing. Okay. Scrub the hub one more time. Let it dry. And I'm going to apply a cap to it. Keep it nice and clean. Okay. Now I'm going to open my fluids back up to the appropriate rate. Of course, we weren't using an IV pump, we were just using gravity, so I don't have to worry about stopping or starting my pump at any point during this, just making sure that I'm clamping it off. Okay, now I'm going to apply my piggyback. I'm going to make sure that I date and time any of my tubing that has been used today. Now I'm going to go for the spot away from, farther away from the patient. I'm going to clamp it back off again. Okay. Once that is clamped off, now I'm going to open this. I'm going to scrub my hub really good. Let it dry. And then I'm going to apply the piggy bank. I'm going to, of course, open it up. I'm going to set it to the correct drip rate as well, since we're not using any pumps today. And I'm going to open my primary up as well, since we're not using any pumps today. Okay, of course, since I'm giving medications, I'm going to make sure that I always come back, check on my patient pretty quickly, make sure that there's no reactions to any of the meds that were just given. Okay, I'm going to get all my stuff together. I perform hand hygiene again after I grab all of my stuff. And I'm going to go out and I'm going to report and record what I've just did.